Hi, I'm Ruth Heidebreck, and I'm at the MIT TV podcast studios, and we are featuring Dr. Joel Kahn today because he's going to be visiting the Washington Township area to be a keynote speaker for an upcoming event May 8th at Greystone Golf and Banquet Center. It's going to be from 5:30 to 8:30 p.m. It's presented by the Businesswoman's Connection and our Northern Macomb Regional Chamber of Commerce. As a holistic heart specialist, Dr. Joel Kahn will be speaking on why we must know our heart age. Welcome, Dr. Kahn.
Thank you so much. A total pleasure and honor to be here.
It's so good to see you again.
Thank
We have not seen each other um, many times since you were here almost 10 years ago. And if you recall, we did this, I asked you to do this initiative with me to bring in people that were either had high blood pressure, high cholesterol, or pre-diabetic. And you brought your entire center, you brought the most amazing doctors right here to Romeo. And we had 92 people sign up. And it was extraordinary. 82 people stuck with the whole program, which was a 90-day program. 5 restaurants created 3 menu items, plant-based menu items, and we met 3 times a week, and they got the whole 9 yards for free. You guys provided speakers, you provided mental and physical support, and out of that, at the end, we had the most extraordinary numbers. As far as out of 83 that stuck with us during the 90-day program, 52 of them lowered their blood pressure, 33 registered non-pre-diabetic after being pre-diabetic, and 16 were reported as lowering their cholesterol, thanks to your team at the Kahn Center. Isn't that amazing?
Thank you. I don't know that I've ever actually heard the final statistics. They're amazing. Obviously, if we did a little early push, it's your and your team's hard work that brought it across the goal line. So congrats to you too.
Yeah, it was fabulous. You want to do it again?
Uh, do it again. The
All
change
right.
for the better. Let me know.
Okay. So you're going to be a keynote speaker May 8th at this Holistic Women's event. And you're going to be talking to us about why it's important to know our heart health. But for our viewers, why should heart disease matter to everyone, especially women?
Yeah, it is, I think, one of the strangest phenomenons of modern medicine. I'm going back 50 years, that people are either inattentive to heart disease, bored with heart disease, uninspired by heart disease. But heart disease is like a Rodney Dangerfield. You get no respect. I'm not saying cardiologists don't get esteem or aren't rewarded or don't show up now and then, but I'm telling you that there is actually media statistics. People go online and want to read about health and why they're going to die. They do not read about heart disease. It's incredible. And remember, and actually to back that up, when you look at New York Times or English newspapers, how many times do they talk about heart disease?
Yeah.
It's almost non-existent. It's amazing. And I'm a media addict. I'm
Yeah, you
always
are.
medical sites and other sites. Heart disease does not come up much.
What's the
Everybody wants to
statistics?
get rid, people want to get rid of PMS.
Yeah.
Excuse me. People want to get rid of bloating. People want to deal with their skin. People want to anti-age. Well, you can't anti-age. You can't really be involved in a longevity program if you don't understand your heart. And just real quickly, just hear this, audience. Every 34 seconds, somebody in the United States dies of heart disease. Around the
Wow.
world, every 1.7 seconds, if you include the whole world. Every 2 seconds, somebody dies of heart disease. Every 40 seconds, somebody has a heart attack in the United States. And finally, this is, I think, the most amazing statistic. Between 1775 and the present, 650,000 American soldiers have died in combat. Honor their memory. 900,000 people will die this year of heart disease in just 1 year. And we do not consider heart disease an enemy. We don't consider them an invading force. We don't consider heart disease a number one threat to the health of the American population, but it should be. So
Mm-hmm.
hopefully, in this short interview, we'll stimulate some thoughts about why do I go to my doctor and he mentions colonoscopy and mammogram, but I don't hear anything about heart disease. It's wrong. It needs a change. Today we'll talk about how it can change. It's not actually that hard to accomplish, great things. It's easier than having a colonoscopy.
Why don't they ask those questions
Well,
of their patients?
number one, heart disease is tricky. I'm telling you, everybody listening has heart disease. Hopefully, very little,
Really?
because if you're over 20, you've got a little bit of plaque
Okay.
disease in your arteries. May never cause you a problem,
Mm-hmm.
but if you actually studied people in their 20s and 30s, you'd find it. But, it's years and years and years before somebody drops dead or has a heart attack. So they come to the doctor's office. They don't have any complaint. They're not short of breath. They're not feeling chest pressure. They're not having racing heartbeats or blackouts. And doctors can be lulled into complacency, not that they don't know, healthcare practitioners, that this is a long silent disease till it suddenly strikes, but it is a long silent disease. Mrs. Cohn, Mr. Schwartz, Mr. O'Brien, Mrs. Moore, you're feeling fine, great, see you next year, but be sure to get your mammogram and your colonoscopy.
Yeah.
It just doesn't strike. Number two, they don't believe, nor does the public, that there's an actual screening test that fills the need, just like mammograms, colonoscopies, prostate exams, cervical cancer exams. They don't think there's, and we can talk about that today, real quick.
Mm-hmm.
There is such a test. Everybody should have, and so we need to be aware that heart disease is the number one risk to your life. You cannot be focused on a long and healthy life and see your grandchildren grow and go to weddings and without knowledge of your heart health. Because if it's not optimal, there's so much to do about it, but we're missing 80% of the people that have heart disease. We're waiting
Wow.
till they're in the emergency room to identify them. We don't do that. We don't wish you to have cancer, then we'll find your cancer. We're proactive, but we're not with heart disease. So all those factors lead me to be very aggressive and try and teach people. I use a hashtag test, not guess.
Mm-hmm.
If you're playing pickleball and you're traveling and you're enjoying your middle years, your later years, I'd say, 40 and up, and you don't have knowledge of your heart, know your heart age, you're living in a la la land that may work out great for you. I'm not all scary, but it may not work out great for you. And then you'll say, damn, I wish I would have listened to that crazy doctor on that.
How do you find that out?
Well, okay, first of all, you'll be aware of just simple basics. We know that part of the equation for developing a heart attack or dropping dead, it's called sudden cardiac death,
Mm-hmm.
are some simple factors. If you're smoking, quit. If you don't own a blood pressure cuff at home, you're a real amateur. You have to own a blood pressure cuff at home. Blood pressures in the doctor's office are notoriously high. White
Mm-hmm.
coat, white
Yep.
coat convention.
My mom had that really
There's
bad.
going to be a day you're a little dizzy or a little winded.
Mm-hmm.
You don't feel well. You got to have a home blood pressure cuff, and you want to get one, fits on the arm, and all you got to do is hit a button.
The one on
There
the
is,
wrist doesn't work
yeah, not nearly as well.
as efficient. Okay.
Yeah, and there is a company, I don't own it, very famous called Omron, Omron. Good brand. If people want to know what do I buy online, get an Omron blood pressure cuff.
Can you get it
Please
on Amazon?
don't smoke. Check your blood pressure once a week. It's easy. Sit in a chair, feet on the floor, nice and relaxed, and do it 3 times in a row, about a minute apart. 120 over 70, that's normal blood pressure. If it's above that,
Is it higher for as you get older? Should you
well,
expect it to be
because the
higher?
bodies are, it's not a natural phenomenon. It's a aging disease process phenomenon.
Okay.
And all the data in the world is normal blood pressure in the elderly is the same as normal blood pressure in the youth. Yes,
Really?
more common, certainly.
Oh,
almost every disease under the planet is more common as we age. So,
sure.
number
So you
three,
do it three times?
know if you're pre-diabetic or diabetic.
Yep.
That's lab. Know if your cholesterol's, 134 or 444. You got to have blood work. And number five, know your family history, mom, dad, brother, sister, grandparents. That gives you some sense. Number two, there's a few extra blood tests everybody should have. I'll just say real quick. I wrote a book. It's easier just to show it.
Yep.
I wrote a book about a cholesterol. What a romantic book. Lipoprotein A. There actually are amazing recipes in the book. But lipoprotein A, you can see how it's written. It's actually called lipoprotein little a. That's a
Mhm.
blood test that you can ask your doctor for. I'll put it up there one more time for about 20 bucks. And it's a genetic cholesterol that can, in some people, cause early death, early heart attack, early stroke. And nobody's checked for it. I do. I've been checking for it for 15 years. I have an enormous cardiology practice with people from all over the world that find me because I wrote a book about it. Ask for that. Ask for your vitamin D level.
Okay.
Ask for a inflammation blood test, high sensitivity C-reactive protein. But most importantly, if you do nothing else, take $100 and put it in a special jar. Don't spend it on a dinner. Go call Henry Ford Hospital, McLaren Hospital, Corwell Hospital, Genesis Hospital, or any of the others, and ask your primary care doc for a prescription for something called a coronary artery calcium CT scan. I wrote this book called Dead Execs Don't Get Bonuses. A
I
title
haven't
is
seen that
scary,
one.
but I basically wrote this book to convince people, if you can see,
Hmm.
get yourself a 5 second CAT scan, CT scan.
Yep.
Will show your heart arteries and show us if they're getting disease or if they're staying clean. There's nothing injected, there's no allergies, there's no pain. It takes about 5 seconds.
I've,
Coronary artery calcium CT scan. It's the equivalent of a mammogram. It's the equivalent of a colonoscopy.
I've had
Is
two of them
my
in my
heart
life.
good? Is my heart good, or do I
Yep.
have silent heart disease? Am I playing pickleball with silent heart disease? Am I going on a trip to Bali with silent heart disease? Maybe you don't need anything. Maybe you need a baby aspirin. Maybe you need a change in diet. Maybe you need to lower your cholesterol naturally or with the aid of supplements or prescription drugs. Maybe you got to bring your blood pressure down. Maybe you got to drop some weight. Find out, test, not guess.
Yeah.
That's the most important test on the planet that under 5% of people are getting from their primary care doc.
I'm in my mid 60s and I've had two of them, but they talk about plaque. They don't, is plaque
Well,
the heart disease or?
they talk about calcium.
Hmm.
It's good to have calcium in your bones and in your teeth. It's always abnormal to have calcium in your arteries. Now, you can have a little bit and you can have a boatload, and there's a
On your
difference
brain.
over time. But even anything over zero, I will say I'm about to turn 66 and I am
Me too.
zero over the years.
Yeah.
And that's a whole lot of spinach, arugula, and bok choy. A whole lot of plant eating, I think,
Hmm.
uh, and all because I work like a crazy man. So it's not like a perfect schedule. It's just very, very clean plant diet. But that's what you got to do. If we want to have a war on heart disease, if we want to stop this crazy statistic of somebody dying every 36 seconds, we just got to start screening people with better blood work, screening people from age 40 on with better imaging, and then give them a program. Could be as simple as changing out the sausage and the bacon for oatmeal and a green smoothie. That's going to make a difference. Could be as simple as actually using your treadmill, not hanging your clothes on your. Could be as simple as getting 7.5 hours sleep, not five. Could be as simple as getting the heck off of cigarettes, of course. We got to
Right.
stress. So,
Why does more sleep have to do with heart disease?
yeah, it's nothing I learned at the University of Michigan all those years ago when we learned about heart disease. Interesting. I was reading a paper. I graduated med school in 1983. It blows me away. 42 years ago, University of Michigan. And what I learned then is still basically what's being taught. I read a research paper from 1961 this week on heart disease. And pretty much the intro I could still use in any lecture. Heart disease is number one. Heart disease is silent for a long time. We know what causes heart disease: high blood pressure, high cholesterol, high blood sugar, smoking, poor sleep, stress. But sleep has really come on that people with poor sleep may also have a poor diet, may also have extra stress, may also grab a cigarette more than others. And there's something healing and restorative about getting 7.5, 8 hours sleep compared to somebody that limits their sleep to 4.5, 5 hours. Just
Sure.
not enough. And certainly, if you snore and you stop breathing, get to somebody that can do something called a home sleep study. And if you have sleep apnea, you need to really, really get that treated because all those things influence your risk of heart attack, stroke, and dying early in life. Just a
Right.
shame.
So so what you're saying is you're really not going to be able to detect it. There's not going to be any signs. If you're feeling good, you're playing pickleball, you think you're active, that you really just need to add that to a
Yeah.
yearly or every 5 years. How often should you?
If you come back zero, the perfect CT score,
Hmm.
you do it again. It's recommended in 5, 6, 7 years and see if you're staying as zero. And if you are, great. If you come back very abnormal, you just need other testing, not that testing. And I don't repeat it. There's better and more advanced tests if you come back quite abnormal. I will say, I don't know how many people listening are men or women, but if it's an all-female audience, women, no men, of course, that if a man's starting to have erectile dysfunction,
Right.
should be an alarm bell, not just to talk to the family doctor and get a prescription, which you can also buy online now for Cialis or Viagra. Those drugs work and they're
Hmm.
generally quite safe. But a man starting to experience or who has been experiencing erectile dysfunction for a while, a real self-esteem killer and all, uh, easily may have early heart disease. It's a disease of blood vessels, below the waist and above the waist. So we call it an early warning system. Not so simple in a woman, but in a man, where in your 40s and 50s, heart disease is more common in men than women.
Right.
So, if women are listening to this, kick that man to the doctor and say, get your heart checked. I'm very worried that you're struggling with this issue. Yeah, it may prove to be just stress, too much on the mind, too much booze, low testosterone.
Right.
Uh, but very often it's a important clue.
So the first step is to go get to your doctor, your regular doctor, general doctor, and then ask them for a prescription to get the
Coronary
scan.
artery, calcium, CT
Then
scan.
you can go from there when you find out really how bad off you are or how good you are,
Right.
right?
I every day tell people they're bullseye, perfect zero,
Do you
and
have perfect zero?
I'm a perfect example. Well, we don't tell those people, and be sure you add bacon and sausage to your plate. No, you still got to worry about cancer and dementia and
Yeah,
other things. So you still got to, toe the line, but
right.
you've got, the best health report you could hope for.
Well, that leads right up to what you basically live for, Dr. Kahn, which is a holistic method or diet that reverses those conditions. Can you tell us a little bit about that and how it's been proven?
Yes. And, really quickly, there was a rise in heart attacks in the United States. Actually, there's parts of the world that heart attacks are still unheard of. And they're usually like tribal communities
The
that
blue
eat
zones.
primitive, real
Mm-hmm.
food, plant-based food. And then there are those communities called blue zones where they have a heavily plant-forward diet and people have tremendous longevity.
Right.
But in the United States, it was relatively rare to see heart attacks before World War II. But after World War II, women went to work. We got refrigerators and freezers so we could buy frozen food.
Mm-hmm.
Soldiers came home with cigarettes. A lot of life changed. And, in the 80s and on, we started to see this tremendous rise in obesity and all. And heart disease has just, exploded since then. So a lot of research went into the question, why is there so many heart attacks now when there weren't before World War II? And nutrition was actually not assumed to be a major factor until a few investigators and researchers looked at it in a very scientific way. Bottom line, plants are fruits and vegetables and nuts and seeds and beans and peas and lentils and soy products like edamame and tofu win the game. They lower the risk of heart disease. And if you have heart disease, they actually can help reverse heart disease. So some people call it a vegan diet, a whole food plant-based diet, a vegetarian diet if you're not completely there. The science is overwhelming. That's a heart disease prevention, a diabetes prevention, a cancer prevention, a dementia prevention, an obesity prevention, lifestyle choice. You can do it 95%, you can do it 100%. And
Right.
don't do it with frozen vegan pizza. You got to learn how to cook a little at home. Batch cook, get a pressure cooker, an instant pot,
Okay.
get the recipes. I
Yeah.
did a book. I'm not trying to sell books, but I wrote a book that's done very well called The Plant-Based Solution.
Yes, I have it.
This one is also full of many simple but delicious recipes.
And desserts.
And, we've learned over the years in actual research studies, and they continue. I mean, every
Yeah.
month there's new research studies. Now we know that prostate cancer and breast cancer and kidney cancer and dementia and other diseases are influenced by choosing a plant predominant, plant-based vegan diet over a heavy meat, cheese, butter diet. Not a good choice. The worst foods are the sausage, the hot dog, the pepperoni, the corned beef, the processed meats. They're by far the worst.
Butter is bad for you?
Butter was just studied. It's been a debate forever. And there certainly were clues because butter's high in saturated fat. But there just was a massive Harvard School of Public Health study about 2 months ago of the health outcomes in over 100,000 nurses and doctors that they found of butter versus any plant oil. And that
Margarine, not
triggers people because we know olive oil seems to be a very healthy choice.
right.
But all the other plant oils, it doesn't matter. You drop your risk of heart disease and cancer by about 20% when you pick plants over butter. Butter is an animal food. Butter people call liquid meat, and it is
Ew.
basically liquid meat. Yeah.
So I remember you telling me years ago that you could cut in surgery, you could cut into someone, whether they be vegan or plant, meat eaters or whatever, and you could tell what they eat. You could tell the oil and the processed foods that they eat.
Yeah. Heart disease is not completely a dietary disease. There are people that eat poorly that don't get it. There are people that eat vegan, they get heart disease because genetics make a difference.
Yeah.
Also, some of my people, I ask, how long have you been such a healthy eater? Oh, the last 2 years. Hooray, I applaud you. But we have 60 years of cleanup to do. And, it may take a little while for you to gain all the benefits. I don't think anybody's bulletproof. I
Hmm.
don't, I got somebody comes to my office and they're just down the checklist doing everything right. They're still getting a heart workup.
Is that from genetics?
You have to consider that. And I think the most common is, you may have gotten this from
Hmm.
mom or dad. It's not based on diet or exercise. It's mom or dad. It's genetics. So you may be doing it all right, and boom, one day you're in the emergency room and you find out, damn, I didn't know I inherited that. If you know now, we can make a plan for you what to do about it.
Right. And if we write that word down, we can take it to our DO and he'll
Yeah.
write us a prescription to get it
Right. And
scanned.
by some chance, they resist you because there are docs don't feel comfortable doing something that they aren't an expert on.
Hmm.
You can go online. You can just pay for this lab at
Oh,
Quest
okay.
LabCorp or lifeextension.com and
Yeah,
maybe
I did
spend
send for that
25,
actually.
30, $35 to just get it done.
Great. Okay. Well, we all know that you can't spend too much time with us today, but I hope that you'll come back and talk to us about more about heart health.
Now, lots of fun topics, no doubt.
Yeah. And we will see you May 8th at the spa for the soul at Greystone. And we also at this event have 12 holistic vendors offering free gifts to everybody and a light dinner, little wine, and that's all for $40 a person. So come join us for a wonderful evening of health, happiness, and bring your mom for Mother's Day. Give her
And
an
I will
evening out.
tell all the secrets. I
All the
always give
secrets.
away, but I'll tell the other secrets if you come live to that meeting.
Wonderful. Thank you so much, Dr.
Thank
Kahn.
you.
We know you're a very, very busy man, and we so appreciate your time.
Thank you.
All right, I'll see you soon on May 8th.
Bye bye.
Bye.